Hello and welcome to Schein Chats. My name is David Kochman. I'm the Vice President of Corporate Affairs at Henry Schein, and we're here to talk about opportunities for diagnostic testing in the pediatric dental setting. And I'm privileged to be joined by Dr. Jessica Lee, who is not only the Chair of Pediatric and Public Health at the University of North Carolina's Adams School of Dentistry, but she is also the President of the American Academy of Pediatric Dentistry. Dr. Lee, thank you very much for joining us.
Great. Thank you, David. It's certainly my pleasure to be joining you today and to discuss this very exciting topic.
Well, we're privileged to have you. And maybe first we should start with just talking about AAPD. Could you tell us just a little bit about what this association focuses on?
Sure, absolutely. The American Academy of Pediatric Dentistry, the AAPD, has always worked towards optimal oral health for children. That is, we work on making sure that every child, the US and internationally, grows up with great oral health. And that's been our mission from day one. We believe no matter what race, what background you come from, what advantages and disadvantages you have, that every child deserves a good start with good oral health. We focus on prevention. We do believe that's a preventable disease. Dental caries in children is the #1 preventable chronic disease of childhood. So we have some work to do, but we believe we can do it. We believe that good oral health gets children onto a good start in life. So we do want to make sure that every child has optimal oral health and develop very good habits very early on in life.
Well, that prevention and wellness focus is, of course, important. And thinking about this in light of the pandemic, what are some of the effects that you've seen on pediatric dental practice and on children themselves specifically relative to this pandemic?
Yeah, David, I so appreciate this question. Lots happened to us during the pandemic. Families have been through a lot, children have been through a lot. And I always say that, everyone's just making it through day by day. What we really don't need is for families to also have to deal with a problem with children's teeth during the same time. Is what we've seen is that that's what's happening, is that, during the pandemic, we stayed at home, we were afraid to go outside, we delayed care for so many reasons, and that included dental care. For many, many millions of children today. And what's happened is that we know with dental care, a small cavity turns into a big cavity that may turn to an extraction. Some things that could have been prevented. I mentioned, preventing any dental disease in children, which we know how to do if we can get the message out there. But what's happening is that if we're not getting the messages out there and children are not getting to a dentist, that they are getting disease, and it's going to be a challenge. And the disease is getting more severe because they're not getting the regular checkups during this pandemic. And so I can't emphasize enough how important it is to get regular care, even during a pandemic. And, one might say it's actually more important because you don't want a simple dental visit, a simple routine checkup to turn into an emergency care because they have a toothache or because your child's in pain, because we've delayed care for so long. And we are seeing that, we're seeing that with the 8 months that many of us have been, slowly getting back to a new normal and getting back to our routines. And unfortunately, we were playing a little catch up with routine dental care too. So hopefully, we will get beyond that in our dental office and get back to routine checkups. We're seeing a lot of emergency visits for what we call neglected routine care. So we hope that everyone can get back on a regular schedule, as the pandemic, we get a better handle of it. And we'll talk about the testing and other reasons, ways that we can make it safer and more comfortable to get back to a dentist.
Yeah, you bring up so many great points there, including that dental care really is not only emergency care, but it's essential care and it has to be taken care of. And we think about our dental practitioners and our pediatric dentists. These are frontline healthcare workers that are out there that have to provide this care, not only to care for patients, but to keep people out of ERs. What have you heard in terms of perhaps fears or hesitation from some of these pediatric dentists that are practicing either themselves for their dental teams or from patients? What is it that you've heard through AAPD or otherwise?
Yeah, David, I've heard so much. We've heard a lot because we've gone through phases. First, we were told, please don't open your offices. There's shortage of PPE, personal protective equipment, and the frontline workers really need that. Then we realized that, we are frontline workers. We have children that were showing up to emergency rooms that were in pain. And so we also needed to be open. And, of course, we've had the partnership with Schein in obtaining some personal protective equipment that was so critical in opening our dental offices. So we are hearing a lot that, we are frontline workers. We're essential. Dental care is essential. It's of overall health. We know that children that don't get to a dentist end up in the emergency room. We know they don't concentrate because they're in pain. And we so need them to concentrate now that, they've got different formats of schooling that they have, whatever their schooling may look like. So we really need to be able to do this in a very safe manner. This is why I'm so excited about the topic at hand today, because, we have been trying to do this and trying to do it right for the past 8 months. We being pediatric dentists, general dentists, we really, are frontline workers. And we do believe that children deserve access to care, to be able to do it in a safe way. But we've been having to do this with a little bit of an unknown, and that unknown is the testing piece.
Yeah,
We have not known about this. And so this is a very exciting conversation that we're having today.
no, you're totally right, because there's all the componentry that goes into making sure there's a safe environment. And then we add in testing, which is both the capability and technique and proficiency to do it, as well as making it available. So, diagnostic testing has always been available, right? But the pandemic is kind of bringing it to the forefront. What is your thinking, I guess, yourself and on behalf of AAPD, about the ability to use diagnostic testing in pediatric dental offices? What does that open up, and why do people want to use it?
Yeah. Wow. Oh, what a great question, because, for us, I mentioned a little bit of the unknown. We've talked about, do we know what's out there? I mean, there's a lot of unknown with COVID, but, we know that testing works. We know that testing gives you peace of mind. We know that testing gives your team peace of mind. It gives families peace of mind. So this, to me, is a game changer. It's an absolute game changer in the offices, because, for so many unknowns that we have in life right now, that just even a little bit of certainty, a little bit of something that's knowing something that's an absolute, like testing, it's going to make you feel that much better. It's going to make my associates feel that much better, my dental team, my families, my parents, my sick children, that I've got, that don't want to come to the dental office, understanding, what's going on out there. So I absolutely think it's a game changer for us, and to have it out there and to be able to have it an opportunity in dental offices, because children come to the dentist. We have good data on how regularly they come and see us. So to be able to provide that as easy as possible, I think it's an absolute game changer.
And is there a hurdle in your mind about getting pediatric dentists to feel comfortable to do testing? Has there been any reticence or reluctance for folks to do it? And if so, why should they not be fearful?
Yeah, I think that, that's a good question, whether or not how comfortable we might be. And, pediatric dentists has always had, a really a good presence also in the medical field. We are, we always say that, we've got good relationships with our pediatricians. We care about the children's overall health. We do counseling on BMI. We do counseling on, other diseases. And so I think we're very comfortable in this area. We're very comfortable in not just talking about teeth, but talking about the overall health and well-being of the child. And we've always put that in context. Every time we see a child, is the child comes first, and then the teeth come second. So we want to make sure that the child is healthy. So providing testing in our offices is spot on. It's right where we should be. We should be worried about the overall health and well-being of the child first, and then the overall health and well-being of our team members. And then we are able to address the needs that the child needs. But we've been in this area before. We've done some interventions in childhood obesity. We talk about early habits of even weight and body image. So I think that the testing, we have conversations with our families about vaccinations every day. So pediatric dentists are very comfortable in this arena.
Yeah, and if you're able to get those children learning or thinking about kind of a comprehensive health plan with both a dentist and a physician and other doctors early on that hopefully will instill some values and thinking later on in life. Um, and I love how you're talking about the existing interplay already between physicians and dentists, and pediatric dentists in particular. I guess right now we have an immediate need with the pandemic to do testing to assess viral status. But looking ahead beyond this present pandemic, what are some of the additional opportunities you see if pediatric dentists are to really integrate diagnostic testing in their office? What type of testing and how might that help?
I think it takes a village. And so for us, with this pandemic, I always said it's all hands on deck. And so for pediatric dentists and dentists in general to be a part of this and part of the solution, I think it's very exciting. Beginning with testing, that's just the beginning. It's certainly not the end. It's that, we're going to be able to identify quickly, give parents and families more opportunities to find testing. And to make it more convenient. The dental offices are much more convenient and more accessible than hospitals and some physician offices. And you are coming in pretty regularly. So you're able to have it very accessible and easy for the family. So I'm very excited about that piece. But beyond that, what's next? Will we be able to do vaccinations? Will we be able to do other things that can help address this? You're absolutely right. Pediatric dentists have always worked with families to develop a plan to make the child and family healthy. Yes, dentistry is one part of that, but again, the overall well-being of the family and the child is always at the forefront. And for us to be able to provide this and provide it in a very accessible way, and that's pretty critical because right now, I live in two worlds. I've got a dental practice, but I also have a hospital practice at UNC hospitals, and they do testing over at the hospital, but it's very cumbersome. They have to go through another unit and drive through, and then we have to wait for the results, and so it's a different set of processes to get tested there. It's much more complicated. Is why I'm so excited about what's happening here, and to be able to provide dental testing in the dental office.
Yeah, I have so many questions, and I'll try to keep it short here. The first is just kind of a specific one. I think as you look just beyond the curve, are there specific types of diagnostic testing that you think are most readily deployable in a pediatric office?
Well, I think there are, for us, we would love, pediatric dentists are so comfortable with spit. So any kind of diagnostic test that would involve saliva, which you're hearing a lot of. We are very comfortable with anything around the face and the head. So, anything above the neck, I say. So, any kind of testing procedure that would help that any of that area we're very, very comfortable with. But certainly any kind of saliva testing would be optimal for us because that's what we deal with every single day. There are other diseases that you can test for. There's some very exciting things that are happening with diagnostic tests. We talk about, strep or, some kind of respiratory viruses, some lipid testing. So they're very, this opens the door for us to be able to address so many issues in a pediatric dental office.
No, it's wonderful. And again, congratulations and kudos to AAPD for championing so much of this. Last question, this may be on the minds of a number of practicing dentists there. What have you heard has been the reception or feedback from other dental team members about adding diagnostic testing into the office?
The first question, I guess, when can we get it? We hear about this. When can we get it? I've heard everything from, this would be such a great service for my patients. This is such a great service to provide for them this opportunity and this peace of mind. But then I also hear what a great service for our team members that are frontline essential workers, trying to treat children every single day, try to keep them from getting severe disease, keep them out of the emergency room. And it gives them that such peace of mind. And I say, well, this is just the beginning. COVID-19 caused this, and maybe this is the, a silver line that comes out of it is that the dental offices decide, this is an area we need to get into, but this is much bigger than that. We could do so much more with testing in a pediatric dental office beyond this pandemic. We will address the pandemic, absolutely. But beyond that, it's got so much more potential.
It's so well said. Out of a really tragic situation, there's opportunity, and one of those is hopefully expanded care in pediatric and other dental offices, and closer collaboration between oral health care professionals and physicians. Dr. Jessica Lee, the president of the AAPD, thank you very much for joining us on this installment of Schein Chats, and thanks to you viewers for joining us.
And I gotta say thank you, David. It's been such a pleasure working with Schein, and this collaboration between AAPD and Schein is just a model, and it's been amazing to work with you. Thank you.
Thank you very much, Dr. Lee.